Hi, good evening. My name is Tolani Odukoya, and I'm the co-founder of ikarely Health Limited. I'm submitting this pitch for the Impact Toolbox fundraising application. So ikarely Health Limited is an e-health startup that specializes in the delivery of optimal and quality healthcare service to clients at their own comfort and utmost convenience. According to the World Health Organization, it was revealed that the population of patients to doctors in Nigeria is exactly 1 to 2,500. That is, for every 2,500 patients that there are, we only have one doctor. It means that 2,500 patients have access to only one doctor in Nigeria. The access to healthcare in Nigeria is currently about 43.3% for an average citizen. Averagely, at general hospitals, patients have to wait for up to 4 to 6 hours to see an healthcare professional. So I have a case study here. Ebuka, who is a 45 years old man, lives with diabetes foot ulcer. And Ebuka needs to visit the clinic twice in a month to see the nurse for care of his wound, of the diabetic wound. Ebuka was hoping to be in and out of the hospital by 10 a.m. and on getting to the LASUT, as a teaching hospital in Lagos, Nigeria here. On getting to LASUT, Ebuka is tagged patient 85. That is the number 85th patient to be attended to in the hospital. This is our solution. With ikarely app, Ebuka can actually connect with a nurse within minutes to deliver a wound care service at his home to save time of travel and have a more productive day. We also have Miriam. Miriam is a 28 years old mother with an 8-month-old baby. She must visit the hospital for routine vaccination against diseases like polio, tuberculosis, and hepatitis. Miriam works at the bank and has to resume the next day, but her baby needs to be vaccinated. But before Miriam gets this service, she has to get a card, then join a queue, and eventually wait for several hours to see the doctor. With ikarely app, Miriam can actually book the required vaccine for her baby and have it delivered and administered wherever and whenever she wants it. This is our proposed solution. Like I said, ikarely is an on-demand, in-home healthcare provider built to increase access to healthcare services. These are some of our solutions we are providing. Number one, wound care. ikarely will provide wound care for the over 500,000 Nigerians living with one form of wound or the other. Instant vaccination. With ikarely, mothers will no longer need to spend the whole day at clinics. With our wide range of network of healthcare providers, ikarely will provide on-demand and instant vaccination, diagnostic services. ikarely also provides in-home testing like COVID-19 screening, malaria, typhoid, hepatitis, and every other test at patient's doorstep. Our value proposition. Our value proposition is compartmentalized into 2 different parts. For health professionals, we are providing increased income for our health professional because we believe that health professionals, particularly in Nigeria, they are currently underpaid. And by working with healthcare professionals, they can earn passive income. They have by working with us, they have less exposure to diseases. They also have less physical workload by working with us because they work at their own convenience and flexibility. For the public, there's reduced hospital visits, reduced exposure to diseases, avoid long queues in the hospital, and increase productivity. What is our advantage as a startup? Number one, quality healthcare services, on-time delivery of health services, e-referral available, instant access to health professional and medical records. So on our platform, every patient that is a user of our platform has access to medical records. And these are our competitions: Health Connect, Doctora, and HealthLink. Unlike ikarely, Doctora is a platform that connects professionals to patients in using a real estate methodology, meaning that they have a particular facility where doctors and patients meet. But that is not our own case at ikarely. We don't allow our patients to go as far as going to a particular building before they can see our healthcare professional. ikarely would come visit you in your house and save you that stress. Our market is a well-researched and interesting one, and we did fit to say that it is a very promising one also. Who are our target market? Individuals with any form of wound without any urgent need for hospitalization. Babies that require routine immunization after birth. Individuals requiring instant diagnostics tests, discharged patients with diabetes and requires checkup and also wound care. Individuals with busy schedules that need to visit the hospital. This is what our market size look like. 3.9 million people in Nigeria are living with diabetes. 7.4 million plus new babies are born yearly in Nigeria, and apparently they need vaccination. 5.9 million old-aged. We have about 5.9 million elderly people who are aged 65 years and above. 100,000 plus people develop a form of wound or the other, ranging from surgical, traumatic, and ulcer. This is what we have been able to do so far. Our product development. We have been able to build our MVP to the beta testing stage. We have secured partnership with some form of HMO like Reliance HMO. We have also developed partnership with High Impact TV and TVC for our publicity. And we have also gained endorsements of Reliance HMO, who will be our insurance company partner. And we also have a team of highly talented individuals who are the founding members of the startup. This, we believe, is a level of traction for us as a startup that is yet to launch. We also plan to invest massively in marketing with the little available funding and resources that we have. And this is what we intend to do. We intend to actively increase awareness of our product by using SEO, Facebook, Twitter, Instagram, LinkedIn, and the likes of them. We will also use radio jingles and TV ads to increase our reach to more people. As we launch, we will get out free hepatitis vaccine to first 50 people to register on our platform. Referral program, we give incentive to customer per the amount of people they refer. And this is what we are asking for. We need about 1.8 million naira minimum to build our mobile app. At the moment, we have a web app, which is also our MVP. We need about 1 million naira to invest in marketing for a start, about 500,000 naira for operational costs, and 500,000 naira for research and development. In total, we are asking for a sum of 3.8 million naira to launch our products. And this is what our operational units level per economics looks like. So these are our one-off payment services. That is services that you only have to pay once and for all before you can get them. Like our doctor house call, COVID-19 screening and wound care. The doctor house call costs 15,000 naira. It means for you to see a medical doctor to come to your house and do a proper consultation and drug prescription for you, you have to pay the sum of 15,000 naira. Our COVID-19 screening costs 45,000 naira. Our wound care costs the minimal for a wound care, for a minimum wound care, costs 10,000 naira. And this is what our profits look like. For the doctor consultation, our profits is 3,000 naira. For COVID-19 screening, our profits is 5,400, and wound care, our profit is 2,500 naira. So for the doctor consultation, we are hoping to get a request of 1 per day, which is 30 at the end of the month. For the COVID-19 screening, we are hoping to get at least 60 requests. That is 2 per day. For the wound care, we're hoping to get at least 30 requests at the end of the month. And this is what the annual revenue looks like. So these are the services that individuals have to subscribe for. There are subscription services: the general checkup, geriatric care, and diabetes care. This is what they look like. 25,000 naira is the cost for monthly subscription for general checkup. For geriatric care, it's 30,500, and for diabetes care, 20,000 naira. And this is what our annual revenue cost looks like. At the end of the year, we hope to have made a revenue of 68 million naira for every of those services mentioned. And this is what our financial projection looks like. At the end of 2021, we hope to have made a revenue of 50 million naira. 2022, at least 100 million naira, and it progresses like that. At the moment, we have 3 co-founders at ikarely. Paul, who happens to be the CEO and product designer. Paul is a registered nurse, and he also has several years of experience in clinical practice. Of course, myself, Tolani Odukoya, I'm the co-founder and CEO of ikarely. Also currently studying medicine and surgery, while Mercy Thaddeus is the CTO of ikarely. She is a developer and has a wide range of experience when it comes to product development. And these are all other team members, from the full stack to product designer to head of service delivery and chief financial officer. In total, our team has over 30 years of experience in diverse fields that are very relevant in the growth and development of ikarely. Thank you very much, and I hope this will go a long way for us. And I'm using this medium to solicit for your support and funding to help us push this startup to greater heights. Thank you very much.